This is the story of two best friends whose journeys started on two separate continents. With similar career aspirations, eventually, their paths crossed in college. They matured together through medical school, residency, entering their respective specialties, marriages, and growing families. These besties are doctors first and will remain sisters always.
Hey guys, how's everyone doing? So welcome back. This is our Mythbusters episode.
Yes.
So what is a Mythbuster? Well, there's all these rumors out there, right? Rumors about all sorts of health facts, right? People say this, people say that. You don't even know what to believe anymore. So on our Mythbusters episodes, we are going to try to either validate or debunk some of these rumors that you heard, okay? So this episode is Mythbusters Sexually Transmitted Diseases.
Yes, it's true, ladies. Yeast infections are not an STD. So yeast infections are just caused by changes in the vaginal environment for numerous reasons, one of which being antibiotic. It changes that flora, gets rid of that good bacteria that you need, and so then you get this yeast infection develops from it.
Yeast infections can also be an early sign of diabetes. Because your sugar is out of whack when you have diabetes, it allows the yeast to overgrow. And so a lot of times people will get diagnosed with diabetes because they keep getting recurrent yeast infections.
Over and over again. And just like diabetes, it could be also another sign of another weakened immune system disease, such as HIV.
Or being on like chemo for cancer.
Or even as simple as just taking steroids for like gout. That could be causing your yeast infection as well.
So also estrogen containing contraceptives,
pills,
things that you take
patches,
so that you don't get pregnant, right? Pills, patches, the ring, all of those estrogen containing birth control products can actually also increase your risk for a yeast infection.
Absolutely. Douching. Oh my goodness. Don't do
it. We're going to talk about that in another episode.
The vagina cleans itself.
Yes.
No need. It can cause yeast infections. Just the same way as sex can too.
And condoms, right?
Condoms.
So whether it's latex or any of the other materials that are out there, they can actually alter, again, the environment of the vagina and can allow yeast to overgrow. So just having a new sexual partner or using one of these kind of condoms can also put you at risk for yeast infections.
Also pregnancy. It does happen frequently in pregnancy.
Okay, ladies, so this one is false, right? So there are some sexually transmitted diseases that are never cured, but the ones that are able to be cured need antibiotics.
Absolutely.
Okay? So these include gonorrhea, chlamydia, trichomonas, and syphilis. Okay? So there's different ways to treat different sexually transmitted diseases. Some of them you can take a pill, just one pill, and it's over. Some of them you need to be, or some of them you need to even be on pills for longer periods of time.
That's true too,
right? But like Chantal said, you also have some sexually transmitted diseases that need to be cured with IV antibiotics. Some even with antibiotics through the muscle. So it really depends. So when you see your doctor, they're going to be able to guide you in terms of which treatment you really need.
Key thing that you need to know is don't stop your antibiotics just because your symptoms go away. I hear that all the time. Take all the antibiotics that are given to you because just symptoms aren't the sign of cure, okay? Absolutely 100%. False. Yes. You can have an STD without symptoms, ladies. Absolutely. You don't always have the pain in your pelvis area. You don't always have burning, itching, discharge bumps. You don't always have that. Burning with urination is not there. So if you have high risk factors for having STDs, you need to get checked. So those would include having unprotected sex with numerous partners. Every 3 to 6 months, you need to go get checked.
Yes.
Regardless, you should get checked for HIV minimum every 6 months, okay?
So I know there are some rumors out there that there are some people that aren't symptomatic. So usually for men, they are usually symptomatic when they have a sexually transmitted disease, and usually also are symptomatic earlier than women. So it isn't uncommon for a woman to have a sexually transmitted disease and not know it, right? For a while. But for guys, they usually show up. Now, this doesn't include things like warts or herpes. That gets distributed to both sexes evenly.
Yes.
But we're talking more about like the painful urination, the discharge. Those usually show up in guys earlier.
And one last key point. Just because you test positive for one STD, you should get checked for all the others because they like to roll hand in hand, okay? So you get checked for trick, you get checked for gonorrhea, chlamydia, all of them one time, okay? All right. So this one is false, ladies. You cannot get an STD from an inanimate object.
Well, sort of. Okay. So we've all heard the rumor of getting herpes from a toilet seat, right? So theoretically, yes. Can you get a virus from an inanimate object? Maybe, but it's very, very, very rare and therefore very, very, very
I mean, within
unlikely.
seconds after use.
Yes. So if there is a virus that is on an inanimate object, it only lives outside of the body for just seconds at a time. So let's assume that you are going to a toilet seat that someone that had herpes set on, right? So that means that person would have to have an open sore at that one part of their butt cheek that was releasing the virus. They would leave the virus on the seat. Within seconds, you would have to come into that toilet, sit on it.
With an open sore.
Exactly where that person had the open sore in order for there to be that contact, and then possibly you can get the virus. So you see how ridiculous that is? You know, so theoretically, yes, but most likely not.
Well, the same thing applies for sexual toys, right?
Or any other
inanimate object.
Whatever you decide to have sex with, right? Wait, what about other STDs? Viruses like HIV and herpes are actually pretty fragile, so they can't last outside of the body for too long, so they're less likely to be transmitted. But chlamydia, gonorrhea, and HPV, they're pretty resilient, so they can last outside of the body longer. Therefore, they're more likely to be transmitted from one person to the other. So long story short, sex toys should be clean and not shared.
Absolutely, positively, 100% true.
All the time, yes, true.
STDs can be transmitted from sexual intercourse, period. End of story, done.
Yes, it does not matter what body parts go where, but any combination of body parts puts you at risk for getting sexually transmitted diseases.
So let's talk about HIV specifically, okay? A few facts we want to get across to you. Okay, so certain transmissions or certain combinations put you at higher risk, right? So for one combination would be male-to-male sexual intercourse. You're at higher risk of passing HIV.
Actually, the highest out of all of the combinations.
And it's because of the amount of trauma that's involved in blood vessels that are damaged. And so you have that blood-to-blood interaction and puts you at higher risk.
So this one is false. All types of condoms do not protect against STDs. So we will start by saying that there is an STD that whether you use a condom or not, you're not protected from. That is herpes, right? Because there are sores and lesions outside of the area that's covered by condoms. If there happens to be an exchange of bodily fluids outside of that condom protected area, you can still get herpes. So that's not what we're talking about here. In terms of the other STDs, right, that we mentioned before, gonorrhea, trichomonas, HIV. Yes, those are covered by condoms, but not all of them, right? So there's
Let's just
different
give you
kinds.
some facts here so that you can take this home with you. 4 different types of condoms you need to know about, okay? You have latex. That's the one that most people know about. You have female condoms, okay? That's made of nitrile. So it's good for those latex allergy individuals. Then you have the synthetics, okay? That's 2 different types of that one. And then there's the lambskin condoms. So they all have their inherent risk factors that come along with them.
So synthetics, right, are just as effective as the latex,
Mm-hmm.
the traditional latex condoms for preventing the STDs that we're talking about. But the synthetic ones are also less elastic.
Mm-hmm.
So they have a higher tendency of slipping off or breaking. So be very careful with those.
And then to just kind of jump on that point, lambskin is another one you have to be careful of.
Mm-hmm.
Lambskin condoms, the problem with those is they have large pores. And these pores are large enough for viruses like HIV to get through.
Mm-hmm.
However, not large enough for sperm to get through. So it does protect you against pregnancy, but it does not protect you against HIV.
And just a few other things that do not prevent you from getting STDs.
Yes.
So things like being on birth control and does not protect you from getting STDs. Using a diaphragm or a cervical cap, that does not prevent you from STDs. Or even spermicides, right?
No.
Some people use spermicides in addition to condoms to try to prevent pregnancy. That's great, but it does not protect you from sexually transmitted diseases.
Absolutely.
Okay. So this one is true. You do not need to tell your partner if you get diagnosed with bacterial vaginosis or BV. It is not sexually transmitted like gonorrhea or chlamydia or some of the other STDs that we talked about today, right? It's just from an abnormal overgrowth, kind of like how yeast is. So it's not anything that's transmitted, and therefore you don't necessarily need to tell your partner.